You can use these medications to delay your cycle if you want to, or you want to do the first thing which I shared with you, that you are obeying Allah subhanahu wa ta'ala by not performing what you like because He doesn't want you to do that. The dua is, Allahumma innaka afu tuhibbul af fa'fu anni. Cover it. Can the woman take birth control tablets or any medication to delay her menstrual cycle so that in these blessed nights she will be performing salah and she will be fasting during the day? The answer is, as long as the medication you are taking is not harmful to you, does not harm your body, because there is cases where we, like myself as an OBGYN, I will not prescribe it to the patient because it's contraindicated, as we say. It causes harm. So for you need to discuss with your physician. If you are, alhamdulillah rabbil alameen, you are healthy and you have no issues, then yes, you can use these medications to delay your cycle if you want to, or you want to do the first thing which I shared with you, that you are obeying Allah subhanahu wa ta'ala by not performing what you like because He doesn't want you to do that. The dua is, Allahumma innaka afu tuhibbul af fa'fu anni. Ya Allah, innaka afu tuhibbul af fa'fu anni. I am planning to dedicate a special amount of Quran recitation for every day of upcoming Ramadan in order to make khatma, to complete the Quran. But during my cycle, can I continue reading the Quran? As we said, reading the Quran is a different opinion between the scholars. From the four school of thoughts, Imam Malik allowed it for the menstruating woman. The three school of thoughts did not allow the woman during her menstruation to read the Quran. So what should I do to complete my khatma? Read more before you get to the monthly. So for example, it's a 30 days. So every day I'm going to read one part, or juzu as we say, which is about 20 pages. Roughly speaking, some are less, some are more. So here I am, my cycle, you calculate 5, 7, 10, then you add whatever you need to make the khatma, add it to these 20 days. So instead of reading one juzu a day, you're gonna read, you will read maybe 10 or 15. If you, I hope inshallah, this is bi'idhnillah is clear. There was a question here. Okay, what about if the woman has irregular cycle? We just finished, subhanAllah, Jannah Institute, we just finished a whole course about menstruation. We just finished it yesterday, alhamdulillah. And we covered, inshallah, bi'idhnillah, what the woman needs to learn about her menstruation. If you have an irregular cycle, then this is so many scenarios. But in general, for the irregular cycle, if it is always irregular cycle, it depends which school of thought you follow, which means 10 days of that bleeding, you will regard it as your hayd menstruation, and the rest is not if you follow the Hanafi school of thought. It's 15 days of that bleeding is your cycle if you follow the other school of thoughts. The Imam Ahmad, Al-Imam Malik, Al-Imam Shafi'i, for the irregular cycle. And then in between is usually 15 days. So every 10 days if you bleed continuously, 10 days is your cycle, 15 days is not your cycle. So if you follow the Imam Abu Hanifa, meaning 10 days, let's say Ramadan, 10 days I'm not going to be fasting, I'm not going to be praying, 15 days I will be. And then the next 10 days, if I follow again Imam Abu Hanifa, I will be not fasting, I will not be praying. If I follow the other school of thought, it will be 15 and 15.